a lot. Please allow me to stand also on existing protocol. I must say that it's a rare privilege and a honor for just an ordinary doctor like me to be standing in front of very learned colleagues and sharing my opinion. But on a lighter note, I was a little bit afraid, and I was asking myself, don't forget, on a lighter note, asking myself whether I was in the right room when Professor Chukwu was narrating your own ordeal with ethics. But I think lawyers are like doctors too. They are like electricity. You can't do without them. Even when they give you nasty shocks, you still just have to persevere. So we're going to have this discussion today. I think it's going to start, is going to be the beginning of some thoughts that will probably finally crystallize into the laws that might govern assisted reproduction in Nigeria. I hope I'm able to use my slides. Okay, we have clinics in Asaba, Lagos, Abuja, but by and large, when we started, there were just about 3-4 of us all over the nation. But right now, I think there are about 150, 200 clinics. We've lost count. And we know now that there is no other time, there is no better time than for us to be able to put some things down. But that's not to say that some things have not been done up till now. I'm going to mention some of them. I'm trying to see if we can use the slide, but if we cannot, I'm going to speak under 3 main headings. The introduction, where I'm going to define what ART is. Maybe before I even start, the chairman of the panel raised some very cogent points that if I start answering some of them, that might just be what we're going to address throughout, but maybe during question and answers I might be able to answer some of them. So we'll start with the definition of ART and then ethics in very simple language. I don't speak so much big grammar. We look at the scope of assisted reproduction now in the world and in Nigeria. The good thing about assisted reproduction and in Nigeria is that almost everything that is possible anywhere in the world is possible in Nigeria. That's one aspect of medicine that we've made tremendous progress. But that does not mean that everybody is doing the same thing, and that's why we really need everybody to be on the same page. So at least with guidelines. So that if even we cannot ensure efficacy, we can ensure safety. So I'll define ART as all methods of treating infertility that involves handling or manipulating the eggs or the gametes or the embryos. Of course, we know what the eggs are, not the chicken egg, because but the egg of the woman or the fusion of the sperm and the egg, what we call the embryo. So we must manipulate this. And that is the CDC definition of what ART is. Generally, what it involves is that you will give a woman drugs, you make eggs, then you go and remove the eggs from her, fuse it in the laboratory with sperm, and then either you are replacing the embryo back into her or into another woman if she's donating it. So, that's what it means. So, the CDC does not recognize things like intrauterine insemination as part of ART, or the artificial insemination we just mess around with the sperm alone and put it into the woman. That is too simple that we don't regard that any longer as ART, because there's so many things to contend with now, so many methods to contend with. Neither do we regard just giving a woman ovulation induction drugs without the aim of trying to remove the eggs, just trying to make us to super ovulate alone. We don't also categorize that as ART anymore. But when we talk about ethics, we read all the branch of philosophy that deals with the concept of right or wrong. So, and this of course might vary from one society to the other. The way I try to define or describe it, there is a pendulum that swings between what you have the right to do and what is right to do. You know, so you can have the right to do something and it is not right to do that thing. The fact that the law permits you to do it, so you have the right to do it, does not mean it's the right thing to do. And that's what we're trying to put into the practice of ART. That the fact that you can get a 70-year-old woman pregnant, do you really want to do that? Now, we know that human reproduction has generated so much emotion, more than any other aspect of medicine. You know, maybe because that was the first commandment that God gave man: be fruitful and multiply. So anytime we're either talking about people getting pregnant or people having a baby, anytime we're saying that, then people get a lot of emotional, and therefore, even before the first baby from IVF was born in 1978, there has been a lot of emotional interplay. People have started saying that doctors are now playing God. I remember those days when I go to some churches, I have to put on extra protection so that I don't get attacked by the fanatics who say, oh, you are trying to play God or what. But of course that has changed now. There's no doubt that it's the most effective treatment of infertility. About 8 million babies have been delivered from ART globally. And there's been so much advancement we started from, okay, the woman could not get pregnant because her tubes were blocked. And then now we went to, okay, when the sperm count is not good, yes. Now we can even do when the sperm count is 0. Now we can do a lot of things, but most of the advancements question so many things. Now 3 people can be involved in forming a family, you know, what we call it third-party reproduction. So the things, some of the things that my chairman also highlighted are part of it, that whose DNA is that child going to bear. That's the simplest of all the things that she raised, because that's scientific. Yes, we are made up of the DNA of 2 people, the owner of the sperm, the owner of the egg. I'm afraid that so many people are also looking after babies that don't have their DNA, so without even doing IVF, so forget it. So you better do it and people know what you're up to. So what are the scope of ART right now? It's no longer for only infertility. We can do it for so many things to prevent the transmission of diseases. For example, Down syndrome, Mongolism, you know, to prevent mental retardation. It's possible. If somebody has a child who has Mongolism, then it behoves on you to try to screen the embryos in future pregnancies to prevent a recurrence. Now, also, but even now, you know that we know that in Nigeria, we have our population is about 20% of us are carriers of sickle cell trait. So, but now it's also possible for two people who carry AS to get married and prevent having excess children by IVF. We add something to it that we call PGT, and we're able to screen the embryos to see that they don't carry the gene that you don't want them to carry. Also, we can do fertility preservation, either because of people who have cancer. Young girls are getting cancer these days. 7-10-year-olds. Healthcare for them is improving. Maybe you might not see it, so it might not be staring at you, but you see who feels it, who knows it. And for some people like that, there are some girls that have to be taken through the whole gamut of chemotherapy and so on. But we can store their gametes, their eggs can be stored. In fact, ovarian tissue can be stored, though that is not available in Nigeria now because of COVID. Because that was what we wanted to do last year, to make sure that we delivered that. But I'm sure we invited somebody to come and teach our embryologists. Maybe before the end of this year, we should be able to do that as well, to be able to store the ovarian tissue and return it back when we are sure that the person has been cured of cancer. So we can do that, but we can also preserve fertility for women who don't have Mr. Right. Now, I'm sure you must have read in places like Google, Facebook, they are now giving some of their staff the ability to preserve their fertility. So, if for example you are 30 but 32 and you want to preserve your fertility, you can't see any right man in the horizon, you can preserve your fertility. And then you can store the eggs, come back even when you are 42, the eggs that you stored are still 32 years old. So you can still use them. And then there are a lot of good things that we can do. Of course, also we can use IVF to prevent transmission of HIV from what we call serodiscordant couples. When one of them, especially if the man is positive, the woman is negative, we can use IVF so that we don't encourage them to have sex even because they want to have children, unprotected sex, I mean. So we can use IVF to do that, to wash the sperm and use that to fertilize. But as good as some of these things are, like I said, they question so many things sometimes, but there are also sticking points. And those are the things that I think we should face on the last 5 minutes that I have will probably be. Access is what I get asked every day. Oh, why is it so expensive? Why is it so expensive? Unfortunately, it is what it is. We don't manufacture even syringe in Nigeria. So right now, in fact, 5 years ago, it was better for me than now, because now every day I wake up and the dollar just goes up. And for you to do IVF properly in Nigeria, you have to bring everything that you are using from abroad. So cost is an issue. Age limit, that we always just allow you before he even talks. Is my I disturb him a lot, because now people are pushing boundaries. People know now that it's possible. So they are coming from a point of view of desperation. So some of the problems that we have actually is the patients who give them to us. Because now somebody is 70 and he says, he says he wants to have a child. And he wants to use donor eggs and use his own sperm. And then the question is, okay, what happens to you in 2 years' time when the child is just 2? And we all know what 2-year-olds are like. When the child is 10, you'll be 8. Even, I mean, come on, at this age, I can't even handle a 10-year-old, not to talk of a man that is weak. And with the oldest couple that we saw in the world, that was a drama, the woman was 70. She had the baby in India. I think it was just after the record. And then she went into heart failure after delivering the baby. She was in the theater, they took her to ICU after the baby. They went to rejoice with the husband as they broke the news to him too. His own heart also failed. So the two of them met in ICU. So is that what we want to do? Can we afford that? So those are some of the things that we need to look at. Then people talk about, because it's expensive. I don't want it to fail. I have 5 embryos. I want you to transfer all the 5 embryos to me. Now when all of them now succeed, what happens? It's even more ridiculous. Some people say, oh, I want to do surrogacy. Now I have 6 embryos. Transfer 2 to me. Transfer 4 to the surrogate. And I say, okay, what about you follow? Well, in the first place, you cannot do the 2 treatments together. You have to either do your own or do the surrogate. So, but I know some people are lying because there are no laws. You know. So, but what happens if suddenly you are confronted with 6 babies? You are 67 years old, you now have 6 babies. When they are not commodities that you are going to return tomorrow. So those are some of the sticking points. Then marital status. You know, should everybody who wants to do IVF be married? Yes, now because we are doing some things for people who are single. You have a stable relationship, stable job, we can do state IVF for you. But we are not doing surrogacy for such people. Because of, peculiarity of the UK has just lifted that law also, that you can do surrogacy for single people about 2 years ago. But in Nigeria, baby trafficking is a big issue. I don't want to be appearing in court giving evidence with NAPTEC or whatever they call them. So we Then to use donor gametes. Now we are seeing mothers bringing their own daughters to say they want to use their daughter's eggs. You are not married to the daughter's father anymore. You are in a new relationship. You want to have children. You go and bring your daughter, a 20-year-old. One was even a virgin. You say, no, you don't mind if we is virgin. I said, no, I mean, what are you kidding? This is not going to happen here. You know, that's exploitation of one way or the other. So these are some of the things that are coming up. And the doctor also needs to be protected by laws. PGD, we're selecting embryos. We want to be sure that we are not wasting up some normal embryos. Then the fertility preservation, that the doctor also gives informed consent. So that, you know, I had a terrible thing. I'm going to borrow 2 minutes, don't worry. I had a terrible experience last December. I was just about to shut down me. That, okay, it's Christmas. It was a few days to Christmas. I was just going to shut down. And then I got this phone call that changed my Christmas. The woman called me and said, oh, I've been told to see you for fertility preservation. And I said, okay, the voice I'm hearing, you can't be the one who wants to do fertility. And she said, no, it's my daughter. She's 24, she has a master's, and they just diagnosed her with cancer. And of course, how can I go on break when I heard that? So immediately I said, I want to see you tomorrow. So we had a meeting, and then we saw, well, long story short, finally we saw that she didn't have cancer. But she had been labeled with cancer. If somebody would have wiped out with cytotoxic drugs. And that is happening all over Nigeria. There is a case now that we have been called to be witnesses. Like something like that. Somebody who did not have cancer that was wiped with cytotoxic drugs. So there's so many things that are happening, and the only way that we can make sure that we don't, this does not continue to happen, especially just like in every profession, there are cowboys. So even in medicine, there are cowboys. How can we protect the people from these cowboys? So it's only when we can, you guys know how to speak the legal language, we will just give you the facts, and then you can tell us how to go about it. So, and religion is even another thing. I'm not going to touch surrogacy so much, because fortunately one of the panelists will be talking about surrogacy. Religion, I don't want to touch too, because everything is in Jesus' name in Nigeria, though we don't believe in Jesus. So, I'll just say, I'll conclude by saying that I want to join other people who are believers on this side, who are saying that it's high time that we have a culturally sensitive national regulation to guide practice in this vital area of medicine. We should resist copy and paste. The National Assembly was going to do something like that a few years ago. Somebody said, before I leave office, I must make sure I make these laws. And he just went to bring something from a country in East Africa, and he was pushing it. Fortunately, he did not have enough time to push it, because even in that country in East Africa, it's giving them a lot of problems, and that's what they wanted to import to us. So we cannot do copy and paste. Fortunately, I belong to a group of fertility doctors who are called the FRH, who are doing something on it, and we are asking that the FDA should please join us in doing this so that Nigerians and Nigerians will be safer. Thank you so very much.
Thank you very much. If there is one question, please write them down and submit to the ushers.
Successfully, you just have to look for the right clinics. It's not every IVF clinic that can freeze eggs, I can tell you that for free. But if you find the right clinics, I'm not advertising any, you can do that successfully. But what is important is the age limit. Because sometimes you see 40-year-olds coming to me and say they want to freeze eggs. You know, your best bet is to freeze before 35. After 38, it becomes a little bit dicey, you know. But you can still do at 38, but it's a little bit dicey because you need a great number of eggs. If you're going to store eggs, you need actually, and that's what I said. Unfortunately, I couldn't use my slide. about informed consent when you are talking about egg freezing. You need to freeze enough eggs if you are going to have babies from the eggs that you're freezing. You know, actually you need about 15 to 20 good eggs to freeze for it to make sense. So the cost, I can't tell you the cost because of course it will vary from one clinic to another. I don't have an idea because I'll be only talking from one point of view. Maybe about 2 million. Maybe about 2 million. I'm cutting it. Maybe about 2 million. I got pregnant at 40, but after 2 months, I had an evacuation. I never got pregnant again. I'm now 44 years. This is a very important question to me too, because really, I don't know who the person is. At 44, your best bet is to use donor eggs. Use donor eggs. Your best bet, because the chances that even if you get pregnant using your own eggs, the chances that you have a miscarriage is higher than the chances that you can have a live baby at that age. So you're better off using your donor eggs.
Wow.
I think that makes